I really am pleased to be able to introduce to those of you who don't know him and to greet Don Francis for those who do and to congratulate him. We also have other honorees here, Bill Fage, who is one of the previous heroes, and he will be introducing Don tonight and giving the award. So without further ado, I'm going to generate a few questions. Now, we mutually agreed that Don would not know what the questions were. And
mutually agreed means Warren said you're not going to know what the questions are.
I thought we might start out. One of the letters of nomination said that Don's career was characterized by adventureness. I'm not sure I would use that adjective to describe Don's career, but I think I would use a term like dedication, perhaps. And I'd like to start out by asking him to tell us a little bit about his formative years and how he got to be a physician and how he got to be an EIS officer. Could you maybe give us a little background?
Yeah, I'm not sure it's dedication. I think it may be more aptly described as chaos. I was born in California and raised in Marin County, and then in my educational career usually followed a woman. And my girlfriend at the time wanted to go to University of California at Berkeley, so I went to University of California at Berkeley. Another girlfriend at the time wanted to go to Harvard, so then I went to Harvard. And I think the only decision I really made was to go to medical school at Northwestern on my own. So Warren, it was not a planned destiny. It was when I was in medical school, I became, well, let me actually go back further. I went to medical school to be an orthopedic surgeon because I was a competitive skier, and my plan was to go to medical school, get trained in orthopedic surgery, and then live in the North Shore of Lake Tahoe. Thinking about my thought process without recognizing that an orthopedic surgeon really does not have time to ski in the winter because they're taking care of patients. But that logic, I didn't finish that entire scenario accurately. But then when I had my first rotation in pediatrics and had my first lecture in infectious diseases in pediatrics, there was no question what I wanted to do. And I called my mother, who was my grandfather was a doctor, my father was a doctor, my mother was a doctor. So I called my mother, who was practicing radiology in San Rafael, and I think she thought I should probably be a radiologist, something like that. And I said I wanted to go into pediatrics, and she said, "Oh my God, terrible life, you don't want to do that." And then when I started telling her, just like the stories before, that I was going off to various corners in the world chasing infectious diseases, the poor thing probably had a fit every time. But I didn't follow any path. I just followed my this kind of chaos, and I saw walking down the halls of the Children's Hospital in Chicago. There was an ad on the bulletin board that said pediatric fellowships abroad, and I said, well, that's a good idea. And I signed up for that, and they said, where do you want to go? And I said, I don't care. And I went to India for the first time there, and then, interestingly, the great U.S. government had an incredible war at the time. We do this repeatedly for the young people in this room. And the war at that time was in Vietnam, and I was strongly, ethically and morally against that process, and I was moving to Canada. At that time, all doctors were drafted, and I was moving to Canada, and I went to the wonderful head of pediatrics at LA County Hospital, where I was a resident, and Paul Worley, and I said, what hospital should I go to in Vancouver? I wanted to be on the west coast of Canada, so I said, what?
Did you have a girlfriend up there?
That's right. Warren, you're mean. And so he said, well, why don't you join CDC? I said, that's a good idea. And he said, Public Health Service will satisfy your military obligation. And there was CDC people training at the time there, and actually, I stayed in India too long, and medical residents are always from July to July, all your training in medicine. And, when I was in India that time, I said, well, I'll stay longer. And so I was going January to January. And there was a CDC person being trained at LA County Hospital and said, why don't you go off to Nigeria for a few months between that? And I did that. So when CDC's matching program, you go there and you interview and you decide what job you want, and you figure out, what profession you want, what your future is going to be. I was there for 2 years, and I got just a telegram, I think, what do you want to do? Because I couldn't go back to Atlanta for this matching program since I was in Africa. And they said, where do you want to go? And I said, California. And they said, no, we don't do that. And so I said, where do you want to go? And I said, Oregon. I just took the next state to the north. And then it just went on and on from then. And then there was a large smallpox outbreak in Yugoslavia, and I went to that. And after the smallpox outbreak, I was in Atlanta at the smallpox office, a picnic party at Stone Mountain, and I played opposite. They were playing volleyball, and I played opposite this guy here in the gray hair, you can't see him sitting down, but he's 6'7", and he's not terribly merciful when it comes to any competitive event. And that's Bill Foege there, who was head of smallpox. And at that time, Bill and the wise people in the world were deciding whether they wanted to maybe do smallpox in. And I was finishing up at CDC. I'd done my 2 years. And he said, how'd you like to go battle smallpox? And I did. And it just went on and on from there. And so I was there for 21 years without any decision process of my, until some very tough times. And I should mention that for those of you who might think about ever voting for a Republican again in your life, and this is truly seriously, that I had, when AIDS came, and I was working in the AIDS part of CDC, I had meanwhile followed a girlfriend to Harvard, and I didn't know what I wanted to study at Harvard, but there was this very interesting disease of cats called feline leukemia, and so I did my doctorate at Harvard, sponsored by CDC, in feline leukemia, which is really AIDS in cats. And so when AIDS came along, I was obviously involved in that. But when we then were asked, when the director of CDC asked me to write the first prevention program for AIDS. We did that. It was some, I don't know, $40 million or something. It went up to Washington and came back. And this was Reagan administration says, literally the quote back from Washington was to, no, we'll not fund it, do as little as you can and look pretty. And that's not CDC's philosophy, and it was certainly not mine. So I asked to be sent to California. Matter of fact, across the way, finally get back to California.
I'm going to interrupt you for just a moment because I want.
You have another question, Warren?
Yeah. Well, I have a whole list of questions. Obviously, I'm not going to get asked very many of them. But you weren't quite accurate, because how did you get to Harvard? You were in the Epidemic Intelligence Service. You were in Bill's department, and all of a sudden you up and go to Harvard? How in the world did that happen?
I was out of the country, I think 2.5, 3 years by that time, in Sudan and India and Bangladesh. And I felt like I needed to be reoriented academically and needed to do my infectious disease fellowship, which I hadn't done yet, and indeed did my ID fellowship and my doctorate at the same time. And my girlfriend was in Boston. So those things combined, and that's how I applied to CDC for career development, and they sent me to Harvard for 2 years.
You stayed for 3.
I stayed for 3, and that was my plan so that I could have enough time to do my doctorate. And the reason it was for 3 was because Ebola, well, no, it wasn't Ebola, it was some bad disease broke out in the Sudan, and I get this call, the typical CDC call saying, we have this problem in the Sudan. And I said, well, what does that have to do with me? You sent me off to Harvard, and I had my courses and all that at the time. And they said, well, you know Sudan, you speak some Arabic, you know, and I said, what's the disease? And said, well, we don't know. But the electron micrograph looks like Ebola. And I said, Ebola? I said, I don't do class 4 agents. And they said, well, you work on feline leukemia virus. I said, yeah, well, I work in the hood with the virus, and then when I'm finished, I just shake the stuff off. I said, this, as far as we know, doesn't cause any disease. But anyway, I said, how long is it? And they said, 2 weeks. And so I said, okay. And this is the question that came up before about risk-taking. Why do you do things like this? And, you know, why was I a downhill skier? Why do I still snowboard? You know, these kinds of things. So I said, sure. And I went off, and it was really tough. It was way, way, way down on the Zaire border. Communications were hard. But turns out we were thrown in quarantine for 2 weeks. And so, gosh, I don't know how long I was gone, 2-3 months. And so it destroyed my academic year. And so I sent a telegram off. This place has no electricity, but has a little gasoline engine at the telegraph. And I sent back to CDC a telegraph. You're destroying, you know, my academic year being destroyed. Please approve a 3rd year of education, and off it went. And then I found out that went from Maridi, where we were, to Juba, and then it was supposed to go to Khartoum and the rest of the world, but the line was apparently broken from Juba to Khartoum, so they put it on an airplane and sent these telegrams to, and then a week later, the little generator starts again, and I get, from Phil Brockman, I get this, who was the head of the program at that time, saying, application for 3rd year denied. You know, it's like, well, screw you, know, whatever. And then about 2 days later, you get this telegram, typical of CDC, application for 3rd year approved. You know, somebody. Did that answer your question, Warren?
I think that does a pretty good job.
So that, anyway.
But that leads on to the next question, though. The rumor is that within 5 days of the publication in the Morbidity and Mortality Weekly Report of the 5 cases of mysterious disease in Los Angeles homosexual men, that you wrote a telegram or a letter to Max Essex and said that you thought it was a retroviral condition similar to leukemia in cats, and that it would be a long duration, long pull. Is that true?
I think there's some truth to that, but you get tremendous credit for this, but I mean, that's the keys under the light pole story, you know, where the guy's looking for his keys. He's looking at the light pole under the light of the night, because that's where the light is, that his keys were there. It just happened that the light was in the right place, and I happened to have the right light at that time, but it could have been something else, obviously. But this AIDS looked just like, one, it was very bad, which clearly
Well, you had also been working on hepatitis B, and you were running a laboratory at that time. How did that happen?
Well, when I finished my doctorate, then where was I going to go back to CDC? And there were no retroviruses of humans. And the closest was hepatitis B virus, which is, 1, virologically very close to a retrovirus, and 2, has late manifestations. Because at that time, my interest was, I've been working in acute viral diseases for years, and now I'm starting to see that these little things are very, very clever, and how you have an acute disease, and then you have the long-term manifestations of these diseases that tend to be much worse than the acute ones when you start having cancer, et cetera. And so my interest, much like feline leukemia in cats, became late manifestations of viral infections, and the hepatitis group was the ideal location. And it was in Phoenix, Arizona, so I'm closer to the west coast of the United States. No bias intended. But.
Well, so that hepatitis story is a little bit more than that, because then there was a vaccine and a vaccine trial.
Right, so then the big thing at that time was really the first immunization against these chronic infections, which was the hepatitis B vaccine. And Bill was director of CDC by that time and agreed that we should do a phase 3 study of that. And so we took it on to do a phase 3 study. When any time you want to do a study of a vaccine, you want to do it in a group that has a very high risk of infection, so the number of volunteers has to be small. And the largest group that we had been studying for quite a while by that time of at-risk people for hepatitis B were gay men. And so we signed up, how many thousand gay men for a randomized placebo-controlled trial of the hepatitis B vaccine, which led to the licensure of the hepatitis B vaccine, showing it was a remarkable vaccine. But then we had the huge number of specimens from these men over years, and as we were working on the early days of AIDS, Paul O'Malley here in San Francisco, one of our clinics was here, said, there's a lot of these cases of this new disease in the volunteers who were in the hepatitis B study. And so now we had this remarkable group of specimens prospectively collected from people with the disease. So it was a gold mine ultimately. But it was that realization that these people at high risk for hepatitis B also had this disease. And so putting the puzzle together was not that difficult.
Now, at the same time, you were working on we didn't have a name for the virus at that time, but the virus that was causing this disease that you had correctly predicted would be a certain type of retrovirus, which up to that point hadn't been identified in humans. And so you actually were one of the laboratories. Your laboratory was one that actually isolated the HIV, what later came to be called HIV, and that led you into a complicated relationship with a fellow by the name of Gallo, and other relationships with people in Paris at the Pasteur Institute, Montagnier. Can you tell us a little about that story and those interactions?
Well, there was one, the wisdom of the Reagan administration and Bush 1 to follow was a terrible time. And you could ask Bill Fage about the funding of CDC. And we had to make a laboratory out of some rusty buckets in the basement. I mean, it was just horrible. We just didn't have the resources to do all the things we needed. And we needed the expertise. And so this group of people who had worked on retroviruses, one of the earliest discoveries of a human retrovirus was Bob Gallo at NIH. He worked closely with us in Boston with Max Essek's lab, and so I got Max involved, and then Bob and Max we all flew down to Atlanta to discuss how we were going to try to search for the retrovirus. And it was for those of you who know Bob Gallo, he's a very difficult person. The woman who shared an office with me at Harvard went to his lab for a postdoc after she got her doctorate in Max's lab. And when we had all these complications, I asked, how do you deal with this guy? And he said, well, as long as you treat him as a 4-year-old, everything works out fine. And I said, well, that's an adult world, and you better change his ways. Well, that was naive. And then the knowing that we were working on this, I got a call from the Institut Pasteur in Paris, from Francois Ballet, saying that they had this virus growing. We had published articles together in Science at that time, looking at different retroviruses. They were looking at the right one, we were going the wrong one. She said, I think we've got something, and then needed some specimens, and I at CDC, you work with everyone. And so I sent them specimens, and their test looked like it was really good, and it was very exciting. And then we made we were all growing the virus then, and then we all made a serologic test with the viruses we were growing, and to prove that it was the cause was to take the usual specimens from cases and specimens from non-cases and see if and give them blindly out and see if you can identify the cases and the people at risk, but the controls come out negative. And I sent blind specimens to our lab at CDC, to Gallo's lab at NIH, and to the Institut Pasteur. And I was the only one who had the code. And they all sent the results back, and it was clear that we had the virus. It was all of us. There was some variation between the different labs, but we had all scored very positively, identify cases and not controls, et cetera.
Dr. Gallo, acting like a 4-year-old, took your toys away from you.
Well, it was a little more complicated than that. I said, this is a very important finding. We've got to do this right, and both give credit where credit was due, and then be able to move it forward rapidly, because there's lots of things that had to be done. This was obviously by this time, thousands of cases, high mortality, dangerous bug. And so we all met at the Institut Pasteur in Paris and made the agreement that we would announce this together, that each of us would have different papers. CDC would do the serology, the French would do the structure of the virus, and Bob would do the how it's growing and the characterization of it. And that was the agreement, and we all had a plan to write the papers. We left Paris to write the papers, and we were all working on them when the next thing is there's a television show, television news announcement of Bob Gallo announcing that he had discovered the virus, and with little mention with anyone else, and the war began from then on.
Now, there was a meeting that you had with some blood bank people. Can you tell us about that meeting?
The epidemiology of HIV was very clear. Look, just very, very similar to hepatitis B, in that sex and blood sharing with IV drug users and transfusions in hemophiliacs, or factor VIII therapy in hemophiliacs were clearly at risk factors for transmitting this bug. Now, this was all before we had the virus isolated. Or no, it was after it had it isolated, but not all the data were out yet, and we didn't have the test, et cetera. And the test was not going to come out commercially or be available for blood screening for a long period of time, which was literally 12 months. And so we called a meeting. Bill, I think you called that meeting at CDC, of bringing the blood bankers together. Realized that we were very limited in our staff. Bill was stealing people from different sectors to patch this together to be able to respond appropriately. And the transfusion-associated cases were 1.5%, 2% of the cases, 1% of all cases. And the responsibility for that, frankly, of transfusions rests with the FDA. This is a drug, and it was their thing. But Bill called a meeting at CDC to let everyone know what we had investigated, what we knew, and what needed to be done with a disease that looked like it was a disease transmitted by blood. But transfusions were relatively rare cause. But we knew at that time already the incubation period of this disease was long. And so it's this under the surface of the iceberg piece that we were worried about with a long incubation period disease. When you see a little bit, you figure there's a lot more there. And at that time, we had 5 cases of transfusion-associated AIDS. And our teams had gone out to investigate these. And these are tough, because a lot of these people received 20 transfusions, and you had to go out and find the donors. And a lot of times the blood banks didn't even want to give us the names of the donors. And you go out and find the donors and interview them to see if there was an at-risk person, an IV drug user, or a gay man. And IV drug users were excluded from transfusions, so these were essentially all gay men. And the investigations of Harry Haverkost and others at CDC on all the ones that were completed found that there was one at-risk donor in each one of these cases of AIDS. So it all looked very clear that there was an at-risk donor, didn't know that gay men didn't know they should not donate blood. They were at risk by their sexual activity, donated blood to be good people, and ultimately killed the recipient of the blood. It was really a very simple epidemic, and I'm sitting next to an epidemiologist who does very complicated things. This is, you have a group of donors, 5 different cases, a group of donors, and one of them's a gay man, and these people got a disease that is transmitted with gay men. It was not you didn't have to do a p-value on this, it was just logic. And the blood bankers just couldn't deal with it. And we called this meeting to say, exclude gay men and be sure all IV drug users and gay men are no longer donating blood. And a lot of the publicity was saying the gay men were up in arms about this. The gay men were very reasonable about this. If people who donate blood don't do it as for civil disobedience. It's for helping other people. But the blood bankers couldn't handle this for reasons that still remain a mystery to me. That one, they're not change agents. Blood bankers are maintainers, and so changing things is very difficult. And we left the responsibility to them, and they resisted it and said the test is coming around the corner, and killed thousands of people in the end.
Now, you lost your cool at that meeting, didn't you?
I didn't lose my cool, Warren.
Well, I read a document that said you pounded the table. If that isn't losing your cool, I don't know what is.
I was being forceful, yes.
Okay.
I was furious.
I think you were being dedicated.
No, I was really irritated because I did lose my cool. We were sitting around a table like this, literally like this, with blood bankers around it, and then an audience bigger than this in the back, and these guys were just dragging their heels, and it was just the data were clear. We were now wasting our time as they were looking for every excuse, and so I just finally pounded the table and I said, I don't want to do this again. I don't want to waste the time bringing you all here. Just tell me how many people have to die. I know they're going to die. Tell me how many people have to die, and then we'll exclude gay men. Because we had 5 who had the disease by that time. And I said, is it 10? Is it 50? Just tell us. But I did it at the top of my lungs and pounding the table.
All right. I'll accept that.
But I didn't lose my cool.
You didn't lose your cool.
I was just pissed.
I think you were properly, you exercised the proper attitude at that meeting. I want to come back to something you already spoke briefly about. You prepared I guess you'd call it a white paper, something like that, for the control of this nascent epidemic. And that went to, I guess, Bill, and it went on to the White House. And
I think Bill had wisely decided he didn't want to be director of CDC by that time. Is that right, Bill? I think Mason had come in, I think.
And there was a pretty strong reaction. You told us a little about it. I don't know if you want to amplify at all on that, but I do want you to talk about the consequences of that paper that you wrote.
Here is a lesson that has been my plea for quite a while, and I will repeat it again tonight, that you have an expert group of individuals with incredible talent in Atlanta and around the world that are there to protect the public's health. And unfortunately, the former reporting system of that, which used to be CDC reporting to the Surgeon General, who then would have some hopeful independent authority, had years before been destroyed, as had in state and local health departments, the boards of health that used to be there to insulate the health officer from difficult decisions had been removed. And so the situation then is that CDC's expertise is then put forth to a response pattern, which was given to me by the director to write the response pattern, which was a relatively small, I think it was $40 million or something, plan to really work on at-risk communities, especially in the bigger cities of the United States, especially the coastal cities. It was a small program to really do education of gay men primarily and IV drug users. Straightforward program, simple enough, and it went up to Washington, came back, as I mentioned, with not wonderful reviews, which is a lesson that CDC should not be in the reporting authority that it is. You don't have the Federal Reserve in the direct reporting authority because the politics of what the interest rates and such should be would be just horrible, and you'd have a crazy economy. You should have the same situation in public health, where you have to have an insulating authority between public health and the administration. And that's both for good administrations and for bad administrations. With time, I was in Art Agnos's office in San Francisco when he was mayor, and he was excellent. And we did wonderful things in San Francisco, but how many times he would shake his head and say, Don, this is not good policy. What do I want to be out there talking about gay sex and IV drug use? You need public health to do those kinds of things, and you need the insulation from politics, and you need the support of budgets and things from politics, but it has to be independent. And we still have people like George Bush being in charge of CDC right now. And
Well, now you just told us that you were in Agnes' office. You must have got to California. A lot of us think that you were sent down the river or whatever it is that you get when you're sent away because they don't want to listen to you anymore. Back there.
No, that actually is an inaccurate rumor. I asked when this plan went up to Washington and came back and said, "Look pretty and do as little as you can," which was John Bennett's quote when he got the message back. I decided that ethically I couldn't do this anymore, and I asked to be sent to California. I had been in Oregon. I knew the state epidemiologist here, Jim Chin, who you know very well. And I called Jim, and I said, "Do you need help?" And he said, "I sure do." And I said, "I'll be there whenever you want." And he sent a letter straight away. And we got the agreement already at the upper level of CDC. If I could get an invitation from California, they would send me out here to be the AIDS advisor to California. That was my, because this was one of the few places in the world that wanted to do something about AIDS and needed to. In San Francisco, and the question was where to assign me, whether to be in San Francisco or to be at the state. For a variety of reasons, the decision was made to put me here, literally across the street.
And is it true that CDC was being pressured to reassign you to tuberculosis, and that was sort of like Joe Kenyon's situation with years and years before in the hygienic laboratory when he was reassigned several times and got disgusted with the whole business and left. Was that the story with you? Or?
Yeah, this was really horrible, and this is something that should never happen again, and why you need to insulate public health from politics. I was out here, I think, for 3, maybe 4 years at that time, and I got this call. I would go back to Atlanta once or twice a year, discuss. Atlanta was just overwhelmed, and we were just barreling on out here. We were doing California, getting, as you well know, you were up testifying too, to getting California money because the federal money was not there. So we had to write all this legislation, do things that were certainly not in my doctoral thesis. I became a politician, basically. I get this call from Atlanta to come back again, and it sounded benign enough to me, but then I got a call from a fellow Californian who was out there that heard that bad things were going to happen. And I was actually going to a Kinsey meeting on the way to Atlanta for the weekend. And I said, don't worry about it, it's not a big thing. But he said, no, there's a rumor that bad things are going to happen. And luckily, I was staying with Bill and Paula, who was no longer director at that time, but Bill probably saved me from a murder sentence. And then I said to Bill the night before I was supposed to go into CDC, and I talked to Bill and said that I got this rumor that something was going to come down on my head for my, what I was doing out here was essentially just public health, but it was, this was controversial stuff, and it certainly was way ahead of where CDC was. And so Bill gave me some very good advice to be calm and proper, and at Bill's house, I get this call that the director of CDC, Jim Mason at the time, had to go up to Washington that day, and he was going to see me at the end of the day, but he asked me if I could come into his office at 7:30 in the morning and see him first. And I said, sure. And this was Bill's former office. With that table, Bill was probably half the size of this in the office. And at that time, there was this Surgeon General Koop had this silly thing that has carried on to this day, that the public health service is not in the Department of Defense, it's the Department of Health and Human Services, but it does go by military standards. These are officers, and there indeed is a uniform that in some places they wore them. And here I went into the public health service to avoid the military and did not feel very strong. And none of us wore uniforms early on. And then Surgeon General Koop really got into these uniform thing. And CDC and the NIH, everyone fought it, but CDC at least lost 1 out of the 7 days of the week, and you had to wear these uniforms, which luckily, since I was in California, I didn't have to do. Anyway, so I walk into Mason's office, and he's in this uniform. He has these teeth that are as white as the top of that thing, and he had this white summer uniform on. And he didn't know that I didn't have any rumor at all. And he says, "Good morning, Don. Good to see you. I'm glad you're coming back to Atlanta to work on tuberculosis."
And with that, he came to California again and began...
No, well, it gets worse. The word was from Washington to fire me. They wanted to fire me. And being an officer in the public health service, it's really like the military. It's very hard to fire somebody because there is this protection. And CDC told the White House that we cannot fire him, and I guess the word was then bury him somewhere else and get him out of AIDS. And so that was the thing about the tuberculosis piece.
So, and that led to vaccine.
That led me going back to Bill Fike. No.
Well, we only have about 10 minutes. I want to get to the vaccine before we finish. In fact, I want to get...
With the help of Jonas Salk and Bill Fage, I won that battle, and they said stay in California until you can retire. But then one more chapter of that, interestingly, is by that time, Bush 2 was out and Bill Clinton is in. And I go from persona non grata to I get a telephone call from the transition team, do I want to be director of CDC? If you don't think there's a difference between Republicans and Democrats, just use that as an example. And I said, I'm too angry, thank you very much. I am in California and I want to work on an AIDS vaccine. So I retired after 21 years.
And you can get this story by taking a look at the television show The Band Played On by Randy Schultz and company. So let's talk a little bit about vaccine. So then you came out here, you joined Genentech and created a subdivision eventually and worked on a vaccine and finally actually did a phase 3 field trial of a GP120 vaccine. And that almost brings us up to date, but not quite.
Yeah, we raised... Genentech was not interested in vaccines. It had protected chimps, and we thought it would, and it got a good immune response in humans. We thought it might be worth testing. NIH refused to do it, so we spun it off. At that time, Genentech said they're not interested, so they said, do you want to start a company? I said, sure. being such a great businessman that I was, trained so well in the government.
He was an adventurer,
Right.
That's what he was.
Yeah. So we went out and raised $100 million to do the phase 3 trials in Thailand and United States and Europe, and had no effect in the IV drug use against Thailand, and had this very strange effect of seemingly protecting African Americans in the North American study. And at that point, there's no way to raise money to continue on, and so then the Gates Foundation calls and says, why don't you spin that part of the company out and start a not-for-profit? And so we have done that, and now have a not-for-profit organization, Gates funded, to work on continuation of trying to understand what happened with the HIV study, and at the same time working on, thank God, some other vaccines. And that other vaccine right now is really working with the pediatric dengue vaccine group in Seoul, Korea, and which is a very bad disease in the equatorial areas of the world. And that would have been a very challenging vaccine in the past, because the severe dengue disease follows the subsequent infections, and so you could have someone with partial immunity and then get dengue and make a much worse situation with a vaccine. And yet that's so easy now compared to HIV that everyone said, yeah, we'll make a dengue vaccine. We'll just immunize and protect against all 4 strains at the same time. So we're doing a lot of work with, matter of fact, like Saturday, go to Seoul, Korea, to the International Vaccine Institute there, who's supporting our dengue work.
So what's the future for vaccinology?
It's wonderful. For the first time, people like Bill Foege and others have influenced a very wealthy man in Seattle to put money where there's this great void of, we've got this wonderful technology to make vaccines, and yet the market for vaccines are a bad business in this country. The money in pharmaceuticals in this country is in therapeutics, because people get sick and they will spend lots of money to get well. And so the commitment to prevention in this country, I spend almost all my time outside of this country now, because I think the commitment here is minimal. Until we get a little more mature here, I'll just do simple things like make and deliver vaccines. So we're, I forgot the question, Warren.
Well,
surprise, surprise.
The question is the future of vaccinology, but I think what you've demonstrated is a career of dedication and a career that has a future in it. We're not talking an old hat, we're talking what's going on today. And even though the time is short, perhaps there are some questions or comments from the group here.
Do not call on that guy with the beard, whatever you do. Yeah, Nancy.
Oh, he's got his hand up.
No.
These guys are irrepressible. All of them.
Don has demonstrated is what we tell students all the time, but he did it in a different way. Follow your passion. He started with passion for girls.
I knew there would be something.
After all, when they say it's not about sex, it's about sex.
You have to know this guy, because when I'm up in Boston doing my doctorate, I had found a girl and married a girl, and the girl was pregnant, and I get this call from the CDC's regional office in the Northeast saying, your wife is pregnant, and you know the Public Health Service Rule 2552, that you have to get permission from the director before your wife can be pregnant. And guess who was the director at that time? So I played very straight.
Yes.
I have a question. You mentioned the environment in our country, a lot of your work is overseas. Do you see that? Is that the political environment? I mean, could you just shed a little insight on that and whether you see that getting better?
As long as we elect idiots to the government, it will not get better. And the need outside, as you have seen, the need outside this country is huge. And there is a commitment from maybe not always government, but there is a commitment for relatively small resources, these nickel and dime things that you and I do to hopefully accomplish something. How much, Bill, did we spend to eradicate smallpox?
Less than $200 million.
Yes.
For those of you who don't know it, Bill Fike is one of the architects of the smallpox eradication program. It was he who originated the idea of circling a case because they were short of vaccine, and for other reasons as well, for practical reasons, using vaccination of the contacts and neighbors, if you want to call it that, of cases of smallpox led to the strategy which effectively ended the eradication program by successfully eliminating smallpox from the human race. Bill is, as I mentioned earlier, one of our public health heroes, deservedly so.
Bill discovered how to eradicate smallpox and then moved ahead to eradicate smallpox and has never gotten the Nobel Prize because of it. Now, you can get the Nobel Prize for discovering an enzyme, but we don't give the Nobel Prize for doing something as important as that. And again, that goes to our maturity and our value systems. Public health is incredibly important and undervalued.
Hear, hear. Well, thank you very much, Don, for being so open.
Thank you.